visible properly. Am I audible properly?
Hi friends, welcome to Dr. Tutorial's interview. Today we have our esteemed, the new faculty of medical oncology who was a student so far, and she has been cracking multiple exams. She has cracked her INI, now NEET. So she has already cracked her INI and was about to join an institute. And after cracking NEET, she's now confused. So these are the moments wherein you actually cherish as to confused as to what college you want. And this moment is extremely happy for all, us as faculty as well in guiding people to choose an institute after the initial preparation and tracking exams with huge numbers of the results. So welcome, Dr. Aparna, and tell me about you.
Sir, I did my MBBS from JIPMER. I was 2016 batch. Then I did my MD in general medicine from the same institute, JIPMER Pondicherry. I was 2022 batch, and I just finished in August of this year, last year.
Right. So Jipmer, and Jipmer.
Yes,
So it's
sir.
going to be that is why I was telling you also the name tag actually holds you for a long time even after your completion. And why medical oncology after your MD specialty?
So during my MD, I had a lot of exposure, especially of hematological malignancies in the medicine department itself. And we used to handle many oncological emergencies. So that's where I got the interest in medical oncology. I had a brief posting also in medical oncology.
Who were the faculty by then?
Prashant sir and Vishwajit sir and Smita ma'am used to be there.
Right. I think we have been under them as well, and we had a very good time. And we know how they actually teach, so it's not going to be something new for you, and you will be having a good time. And how does it feel when you are having both INI and NEET?
Uh, Both were like unexpected, I would say, because exams were were moderately hard. So I was not very sure about what rank I'm going to get. Uh, but from my from what ranks I used to get in the mock exams, I had a confidence I would definitely get some rank within 20.
And now in a single digit rank, that is more adding value to that. So how did doctor
Yes.
tutorials come into the picture? You just completed in August, and now in next 4 5 months you are into super specialty. So when did
I
you start
started my
preparation?
preparation.
When did
Yes, sir. I
yeah.
finished my MD exams in July last week. So I started my preparation right from August with doctor tutorials. My seniors who were already pursuing medical oncology advised me this is the single best platform for the preparation. So right from the very beginning, I used doctor tutorials.
Right. So, which helped you a lot, whether it is the WhatsApp group or the videos or QRP sessions or a wholesome of all this.
It's a wholesome, sir. I made my own notes in about 1.5 months, in the initial 1.5 months, using your video lectures. And then I solved the most of the QBAN, not all, but most. And then I used to give once a week GTs initially, and in the last 1 month, even alternate day for I, and once in 5 days like that for NEET. So I gave a lot of tests. QRPs, yes, like the last 2 days of the exam would be like we have to travel to far locations. So I used to watch QRP. So I even made QRP notes just like 1 month before the exam also.
And for the
And of
future,
course, WhatsApp group.
exactly. For the future aspirants, what she brings out is two important points. One, trying to make notes of whatever you read makes so much of value addition to your preparation because just watching videos or trying to remember might actually not put you into the game show. But when you are taking notes, revision is like a real base for all competitive exam preparations. And the second thing, she had started her preparation right after completion of her MD. So just because you have just passed out this year does not remove you from the game. Many have a doubt of just having passed. Will I have to prepare for one more year to get into the super specialties, For all those who we have interviewed today, have all been passing off in the last 1 year only. So they were so what actually brought them to this level is all about their dedication, their preparation, and actually believing the process and sticking on to the process. So that actually makes huge differences, and not much of hi-fi stuff. Sticking to the basics, trying to add revision to the basics actually meets the exam requirements. And how do you want the future aspirants to prepare? Some tips from your end.
Sir, as you told, revision is the key. I made initially I had made a huge note. Then I made like for each cancer, I like one page quick revision notes from my notes itself, and I revised it multiple times. In fact, the last 2 days of exam, I could revise entire medical oncology from my like the quick notes that I made. So revision is the key because medical
So
oncology is after all very volatile. So
exactly, very true. So the subject is huge. Not only it is huge, it is more changing branch of medicine so far. Every day you have some updates.
yes.
Exciting are the updates, but then sticking to the basics and revising them actually is the requirement for all these competitive exams. Updates are fascinating, but those are fascinating and adds only when you are already strong with your basics. So these points actually Aparna has brought out nicely, uh, as she has advised all of us, for all the future aspirants as well, trying to make a bigger notes to understand the concepts, then trying to make a small quick revision notes actually has so much value addition in the final moments of preparation. The most important question people ask, how to prepare in the last 2 days, because there is anxiety, there is so much of restlessness during the last 2 days, and we are stuck with so much portions as well. So the initial preparation, if you are able to plan in such a way that the final few days or a week, how you are going to actually revise, makes so much of difference for all those rank winners. Thank you, Aparna, and all the best. Now that you are stepping into a branch, this is just a beginning. You will start seeing patients. All your theory is going to be converted into patient approach. Every patient is going to be different. Though there might be five leukemias in the ward, not all are going to behave the same. You would have had some exposure during your MD days as well. Now you're going to get into the hardcore oncology, so it becomes more and more important for you to have your theoretical background and also your application. And take it from me, medical oncology is 20% oncology and 80% medicine. So you are going to
Yes.
actually do a different form of your medical practice only, wherein you are going to manage your side effects, your nutrition, your other therapies. Everything is going to be holistic for the patient. So that is how oncologist evolves and is supposed to evolve as well. All the best. Do well.
I must also thank you because faculties were always available to clear my doubts. Vijay sir used to give me a call back within 1 hour whenever sir gets free for even my simplest doubts. I must thank the faculty of Doc Tutorials. Thank you very much.
That is where the doubts are never big or simple. Doubt is a doubt. Whenever you people have doubts, when it is clear that moment, you will not have to revisit the doubt, and the whole concept is already into your brain. So that is where we try to get into the picture. Thank you, Aparna, and all the best for the future.
Thank you very much, sir.